Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and once again here with me today, Senator Joe Schiavoni.
Thanks for having me, Larry. I appreciate it.
Thank you, Senator. One of the things that we've been talking about a lot in our field is what's happening at the state level, especially regarding the budget, the upcoming budget changes, and understanding how Medicaid and the increasing costs of Medicaid really affects the state budget.
Yeah, it's a huge portion of our state budget. You know, we had an $8 billion deficit going into this last biennial budget, so we balanced it every 2 years. We're halfway through, and I know the governor has talked about doing a one-year budget and going and looking in it this year and seeing how the state has progressed. I think we definitely have made some improvements. You know, with Medicaid though, I think we need to focus our dollars on preventative care, whether it's drug and alcohol, whether it's keeping the elderly in their homes if they're able to, whether it's getting people out for simple checkups, for cancer checkups, for simple dental checkups, things like this, so that we can nip problems at the bud and not let them get so bad to where we as a state and as a country have to take care of them on state and federal dollars, and that often is the case, and that's often the problem that's happening today.
Well, I know at Meridian, and I know in our industry, we're really trying to push the prevention, because it's really the only way that we're going to stem the tide of what addiction is doing to our society today. But we also recognize that if we provide treatment for individuals, then that is going to be able to reduce the overall Medicaid costs, because if people go untreated, there's additional costs in health care and other things that are going to end up costing the state anyway.
Yeah, no, you're 100% right, and you guys do a great job here of trying to make that point, get that point out there and really drive that home, is that we need to prevent these problems from occurring, because once it gets too far, it's very, very difficult to get somebody back. So when people make mistakes, people are going to slip up and they're going to make mistakes, but we have to deal with the problem now and help them deal with it so that they can become a positive member of society again, get back on paying taxes, purchasing things in the area, buying a home, buying a car, things like that.
Exactly right. And now, when we're talking about Medicaid, one of the things that comes up is the Senate Bill 69.
Right.
And on the surface, it sounds like it makes sense. We're saying, well, people who are receiving Medicaid benefits should be clean and they should be drug tested. But we know that it's not that simple, is it?
Yeah, it's a difficult thing. This gets very political too. The conservative movement is, we got to cut costs and do everything we can to cut costs. So we shouldn't have anybody that has a positive drug screen receiving any kind of money when it comes to welfare, when it comes to any handouts. It makes sense on the surface, but it's a costly system to implement, number one. Number two, you're not thinking about the children that it's going to affect. And also, we have to try to help these people get better so that they are not relying on state dollars anymore. If we just cut them off and throw them in the street, they're going to continue to commit crimes. They're going to continue to do things that are going to be detrimental to society rather than beneficial. And so I think that you're going to see a lot more talks about this, and it's a very, very heated.
Well, and I think that's one of those things that I think you have to really think this through, because you make a very good point about the crime issue and everything else. Most of the crimes are related to some drug issue, and I think that if we take people off of the system, so to speak, then all that's going to do is increase the demand on emergency rooms and healthcare, and increase the crime, and have we really moved forward? Yeah,
you got to fully vet the bill, and you got to really go through it. I mean, I know that there's also been a push by members on the liberal side saying, well, if you're gonna say that poor people are addicted to drugs, then why not drug test every single person that gets any kind of state dollar? So that is going to be a battle that we're going to face this year after the break, and I'm sure I can come back in and we can talk more about it at that time.
Well, Senator, we appreciate your insight.
Thank you so much.
And if you want more information, you can go onto our website at meridiancommunitycare.org.